So you get a lot of people, sort of the classic argument, if everything was run like a startup. But the reason that startups don't have these problems is because there's 10 people there and they can all talk to each other all the time. The moment you get a big bureaucracy, whether that's a private company with 100,000 employees or the NHS, you lose the ability to operate like that, and things do become more bureaucratic and sclerotic. But that doesn't mean there's no improvement that could be made in the public sector on that front.
Well, hello and welcome to this edition of the IFS Zooms In. I'm Paul Johnson, Director of the Institute for Fiscal Studies. Now, from healthcare to education to local government, the public sector obviously plays a crucial role in delivering essential services. But with tightening budgets and growing demand, the crucial question is how can we ensure that the public sector, those delivery bodies, are as effective and efficient as possible? For that reason, the government says it's focusing on public sector productivity. Mind you, all governments have always said that. Rachel Reeves has asked private sector leaders for input on cutting Whitehall waste. Not the first time that's happened either. And Wes Streeting has spoken about reforming the NHS to boost productivity. Maybe you've heard that before too. Well, today we're going to explore what's driving productivity trends in the UK, in the public sector, whether public services are keeping up with private sector innovations, and how policies can foster better outcomes for all. Well, to do that, I'm joined by Ben Zaranko, Associate Director here at the IFS, and Sam Freedman, Senior Fellow at the Institute for Government, and a former Senior Policy Advisor to Michael Gove at the Department for Education. He's also author of the brilliant book, Failed State. Let's start with this question, which we always get asked. I always get asked when talking about productivity, which is a question particularly in the context of the public sector. What do we mean by productivity?
Productivity in the public sector is about how much public service we can get for the stuff that we're putting in. So how efficiently can we turn public sector staff, public sector buildings, equipment and so on into the services that we care about, things like healthcare, things like teaching in schools, things like social care for the elderly. It's about how much we need to put in to get a certain amount out. Now, it's conceptually tricky. In the private sector, when we measure productivity, you have things like prices you can use to measure the value of what they're producing. In the public sector, we often have to do without. So it's just a bit of a different exercise, and it's not really strictly comparable to what's going on in the private sector. But it's clearly an enormously important issue, as it tells us, how effectively and how efficiently are we spending more than £1 trillion every year.
Yeah, and that's complicated because how you compare a new hip with a heart operation, how you compare an A star at GCSE French with a B at GCSE Physics is, I should use numbers nowadays, shouldn't I, rather than letters for GCSEs? But hey, how you make those comparisons is very complicated because there's no market price for them, whereas we know what the market price for a lemon as opposed to a box of cornflakes is.
Exactly. And in some cases, you can see what the output of the public service is. You can see when someone goes into a hospital and they have a hip replacement, you can count how many hip replacements are happening. In some other cases, it's even harder. I mean, how do you count the output of the army? We spend quite a lot of money on defence every year, but measuring the outputs of the army is philosophically hard. You might want to keep an army even if they're sat idle, because one year you might very much need them. The police is another example. It's just very conceptually hard to think about what those services are producing and how you measure it. And so the ONS, who actually do an admirable job of this, are really at the international forefront, but they measure the output of things like the NHS in terms of how many patients are treated. They try and adjust that for quality, like how many people end up getting readmitted following hospital admission, things like that. In other cases, they just take how much we spend on the army, for example, and they treat that as the output of the army, because they don't try and get into some philosophical debate about what the value of the armed forces are. So it's just a really difficult, complicated exercise.
Well, we'll come on to specifics, I think, of things like the education system and the health system in a moment. I think we'll leave the police and the army behind at this stage, because I think they're too difficult to measure productivity in. But there is a broad sense, and I think this comes across in the statistics, that public sector productivity has arguably at best stagnated in recent years. I suppose part of the question is that just inevitable given the nature of what government does, given the way in which we deliver health and education? It's very labour intensive, takes a lot of people, probably is always going to take just as many teachers to teach just as many children as it always has done. Are we stuck with stagnating productivity?
Well, I think that over the longer term, there are good reasons to think that productivity improvements in the public sector might be harder to achieve than in the private sector. Teaching children, providing social care to elderly people, providing nursing care in hospital, those things are necessarily quite human-focused, labour-intensive, as you say, compared to something like manufacturing or even other bits of the private sector that just make more use of technology and so on. You might think it's harder to achieve. This is something the economists call the Balmoral effect, whereby the wages for those social care workers have to keep pace with wage growth in those private sector industries where productivity is growing faster. It becomes more expensive to provide public services over time. That feels like a longer term structural trend, but that shouldn't distract us from the fact that public services aren't as efficient as they could be, and particularly post-pandemic, there are some signs of trouble and some signs of really disappointing productivity performance that we should be trying to address, and not just waving it away as a force of the universe that we just have to come to peace with.
Yeah, I completely agree with that. I would also say that because you've got these measurement problems, it can be quite hard to tease out what are real effects versus what are measurement effects. So to take education as an example, one of the things the ONS look at with schools is exam performance. Now, before 2011, exams were marked in a different way, which meant that grades could go up and did go up a lot every year. Now, then they changed the system in 2011 so that grades can't really go up, or it's much harder for grades to go up. That makes it look like the system is becoming less productive, but it's actually not really a real world difference. It's a difference in the way that we're choosing to assess the performance of schools and pupils. So it's tough to tease out all of these different effects. But I would certainly agree with Ben that there is certainly evidence that more could be done.
Well, let's dive into that issue of education a little bit. Certainly, as you say, up till about 2011, GCSE results were rising year on year on year. But that in itself certainly wasn't proof of a more productive system, given the way that those were tested and marked. And equally, as you say, the fact they've stopped going up isn't proof of things getting worse or things stagnating. I mean, is there anything we can say about the productivity of our school system over time?
So I think you can point to a few different factors, some of which the ONS take into account, some of which don't. One of which is that when you look at the level of England's performance internationally, we're doing better than we used to do. And part of that is because other countries deteriorated more as a result of the pandemic than we did, which wouldn't be picked up as a productivity gain, but is nevertheless an encouraging sign about the state of our education system that is quite hard to include in a productivity measure. The other is that far more young people are experiencing education for longer. Many more children, many more young people are in education post 16, and that is picked up. So there are some positive signs that indicate that schools are improving, but then there are also post-pandemic, and I think this issue of how the pandemic has affected public services is a really important one. There are other signs that schools are struggling. So you've seen attendance get a lot worse. There are more children, more young people not attending schools. You've seen behaviour get worse. We've seen a big increase in the number of suspensions from schools. So there's a sort of indication that at the margins, you're struggling with a particular population of more vulnerable children and young people that were being better served pre-pandemic, whilst overall results are getting slightly better compared to other countries.
Okay, I really want to come on to this issue of a more challenging population, particularly among school children, in a minute. But I also wanted to explore a little bit more this point about British schools, English schools particularly, looking like they're doing better on international comparisons. And I think broadly speaking, one of the things the last government would always point to was, have anything else changed? Schools probably got better over time. But there are certainly critics of that view who say, well, yes, on a narrow version, on a narrow measure of numeracy and literacy that is focused in these tests, maybe things have got a little bit better. But if you take a wider view, if you look at how schools have narrowed their curriculum, if you look at the failure to engage people in arts or sports or what have you, things look much less good than that. Is that a reasonable criticism? Because I think that matters when we're talking about productivity, and this is always one of the problems, as we were talking about just now, when you're looking at public sector productivity, because the public sector, particularly in something like education, is at least potentially trying to achieve so much, and it's always a problem to measure it by very specific metrics.
Yeah, and children are only in school for a certain amount of time, not that much time, and there's a lot of different things that you might want to teach them or allow them to do that would give different benefits. There's trade-offs as there are in anything. I would say, I suppose, in response to that argument, that literacy and numeracy measures are not narrow. They're the key thing that schools do, and if you don't have them, you're pretty screwed in your life. So that's the kind of absolute core necessity that schools have to give children, and if they're not doing that, they're not doing their jobs. When it comes to things like sports, arts, in terms of extracurricular, there's not been a drop-off. Schools still do as much sport as they used to. There are still plenty of opportunities for participation in drama and art and so on. What has dropped off are formal qualifications for music, art and so on at GCSE. We have seen a fall there as a result of accountability measures the last government introduced, plus a general waning of interest in those subjects that has been lasting a longer time. And I suspect Labour will seek to change that in their curriculum review and seek to encourage more people to take up formal qualifications in art subjects at GCSE. So it'll be interesting to see what impact that has and whether it works. But I think overall, the fact that we're particularly doing better in numeracy than we used to is really important, because we know that is both incredibly important for individual students' lives and also for the economy as a whole.
But then coming back to this issue of partly what's happened post-pandemic, but certainly the apparently very big increase in demands on special educational needs and disability, and the resources that go into that. I mean, at one level, if you look at the resources going in, this looks like a terrible sort of drop in productivity, but it may be either a genuine increase in demand, in which case it's not a drop in productivity, it's just a response to a changing world, or could be an increase in productivity if what's happening is that kids who are completely left behind are now getting the kind of support that they need. I mean, again, do we have a sense of what's happening there? I mean, and because the scale of this is huge, isn't it?
It is. The cost of the special needs system has trebled in the last decade. And is growing fast, and is a huge problem for government. And I think it may be partly as a result of increased need in certain areas. Certainly, as there's been increases in diagnoses for certain conditions as well. But the biggest driver really is actually changing incentives for schools and parents. It used to be that mainstream schools were quite strongly incentivized and a bit funded to support children who might not have a formal statement of special needs, but needed additional support in some way. After 2014, the funding system changed, and the accountability system became less interested in inclusivity of special needs students in mainstream schools. And as a result, you saw an explosion in the number of schools and parents applying for formal, what they're called education healthcare plans, which are more expensive for children with conditions that may not previously have been considered that they needed something like that. You've seen a massive expansion in the number of specialist school places, the number of children not in the mainstream system who may previously have been educated in it, and particularly an expansion in independent special school provision that is taxpayer funded, which is extremely inefficient. It's very expensive. So I think you've almost certainly seen a substantial productivity loss there. And the new government are sort of looking at the system, sort of thinking, we wouldn't have started from here, which is the problem in a lot of public policy areas, and thinking, how do we redesign this to get more of these young people being supported, but being supported in mainstream settings that are a lot less expensive. But that is incredibly tricky to unpick quite a lot of what's happened over the last decade.
That's a great example, or a terrible example, of how unintended consequences arise from well-intended policy change, because the purpose of this change was to provide appropriate support, because you've changed incentives, and the incentives have driven people down a much more expensive route. That's that's true throughout looking at public services. I think it's also one of the reasons why, just to go back to what you said right at the beginning, Sam, public sector really is very, very difficult. This is not it's not just measuring productivity that's hard. It's also delivering through these very big, very complicated, very dispersed systems. We might come back to education, but let's move on a little bit to health as well. Schools are big, but the health service is an awful lot bigger in terms of its use of public resources. I think probably 3-4 times bigger, I think, in terms of public service spending. So matters even more. So Ben, let's come on to you. And let's start with, what do we know about what's happened to productivity in the health service over the last, well, certainly since COVID, but also in the period before that?
The first thing, as you say, is the health service is enormous. And when we talk about public service productivity, basically what's happening in the NHS will drive everything else, not least because, as we said right at the start, we're sort of discarding the army and defence, and by assumption we can't achieve productivity improvements there.
Let's be clear, we're not advocating the abolition of the army here.
No, to be clear, I am not advocating the abolition of the army. But the NHS is so big, it's going to drive a lot of this, and the NHS is very complicated. That's probably got the most sophisticated measurement of productivity of all the public services, I would say. The NHS was actually one of the few public services in the 2010s to see relatively big increases in its measured productivity up until about 2019. That wasn't true of large parts of the rest of the public sector. So on paper, at least, it was becoming more productive, albeit not growing quite as fast as in the wider economy. Since the pandemic...
Could I just, on that, I mean, it's very striking. If you look at the NHS productivity statistics, they look quite bad through the 2000s when lots and lots more money is going in. It's quite hard for productivity, I guess, to go up when the cost is going up, because you really have to be doing very well with that. And then it looks quite good once the taps are turned off. I mean, is that real?
Well, it's actually less about the cash here, because in theory, at least, the ONS are measuring like physical, real inputs, like the number of staff, number of doctors, the number of stethoscopes, whatever. And then they are looking at number of people being treated and adjusting that. So in theory, the wages for these people, the prices of drugs and stuff, in theory shouldn't really be entering. This should be about how much healthcare are we getting for the physical stuff in front of us. Now, for reasons I'm not going to get onto this podcast, it's not quite as clean as that. But in theory, at least, that shouldn't matter. But it's more about the number of staff grew very quickly in the 2000s. There were lots of big investments in the hospital estate, lots more equipment and so on. And activity growth didn't keep up. So yes, measured productivity fell a little bit during the boom years of Blair and Brown. Then in the 2010s, as growth in all those things slowed to not quite a halt, but to a snail's pace, the NHS found a way to keep growing how many people it was treating and so on even quicker. So it almost seems like a bit of a paradox there, but that is what the data says, at least. Though there were signs that by the late 2010s, some of those improvements the NHS was really starting to struggle, basically, and maybe some of those holding down investment in buildings and equipment for so long was starting to have effects. But then post-pandemic, the scale of the impact has dwarfed all of those, where basically productivity in the health service looks like it's fallen off a cliff, where there's been lots more funding going in, lots more staff. All the inputs have gone up, but outputs have not. The number of people being treated in NHS hospitals hasn't grown at anything like the same pace. Now, there are some signs over the first half of this year that's started to rebound a bit, which is really, really good news for the new government. If the NHS productivity hit is starting to unwind, that is probably the best news Wes Streeting could have. But it's got some way to go. To properly go into why that's happened, I think we'll take a whole separate podcast. But I think that one parallel between this and the schools discussion is that the complexity of need among the people being treated. So whether in schools, that might be more kids who've got special educational needs. In hospitals, it might be more people with complicated multiple conditions that they didn't get seen to during COVID because they were cowering in fear at home. Means that it's just more difficult now to provide the same amount of healthcare because people are sicker on average. And if you're not adequately adjusting for that in your productivity measures, you're not going to pick up the full picture. So we should place, not too much weight on any single measure, but there's enough data points pointing to a productivity problem in hospitals. And it matters a lot for all of us whether that can be recovered.
Sam, you've done quite a lot of work, as has Ben, on this whole question of NHS productivity, and we've had the Aradazi review came out a couple of months ago, which I think to some extent really repeated what we all knew, which was that there hasn't been the investment in scanners and diagnostic machines and capital more generally that you need over the last period, and indeed an IT infrastructure which is woeful, combined with often very poor management, particularly in terms of people management across the NHS. I mean, would that be sort of at the core of your diagnosis as to what's driving poor productivity?
Yeah, I think so. I mean, it was Ben's work that got us interested in this question of why productivity had fallen so much, and so we then went off and talked to loads of people in the health service. This is a piece of work I did with Rachel Wolfe for the Institute for Government last year. We went to talk to loads of people about why this was happening. I think capital was probably the single biggest thing that came through. Lack of equipment, IT, lack of beds. I mean, we've just cut beds way too much, in my opinion. Way more than other European countries, other countries around the world, and as a result, you have this sort of bottlenecking effect in hospitals where there are no beds free. That means people can't come through from accident and emergency departments. So accident and emergency departments get full, etc., etc. Management is certainly an issue. We spend a lot less on management than most other countries. I think it's quite badly designed as well. Very, very top-down managerial approach rather than giving people sort of real autonomy to do their jobs effectively. There's a third aspect, which is workforce. We have a more inexperienced workforce. We have a workforce that's very dependent on international recruitment. There's also an issue which is almost impossible. It is impossible to measure of goodwill from workforce. We heard from a lot of people that there used to be more discretionary effort that the people would make, unpaid, essentially discretionary effort. But as that's not recorded anywhere for obvious reasons, it's quite hard to tell how big a factor that is. I think also the fact that primary care has got worse in some ways, and there are fewer GPs and more demand for GP services has also led to an increase in emergency admissions as well, which is into hospitals, which is also a factor in making them less efficient. So there's lots of different things going on, but probably our historical lack of investment in beds and other capital is probably the single biggest reason.
I mean, I was part of this health commission that the Times ran a couple of years ago. Had all sorts of evidence, spoke to all sorts of people. There are just two things stuck with me. One was everyone in the health service we spoke to just talked about how dreadful the IT systems were. And the other was that pretty much everyone also talked about how bad the line management was, or how bad how badly treated they felt by the system, not having somewhere to sit down if they had a break, not having access to food if they were on night duty, not having, if they're a junior doctor, not having much say about which part of the country they'd be allocated to. And it just seemed mind-boggling, really.
Things like being able to swap your rota so you can go to your best friend's wedding. Something like that, which should be so simple to do, and is done in some places, but there's lots of places where you can't do that, and it's just maddening for people working in that system, expected to put in an enormous effort to not have these sort of little small tweaks made that would make their life a lot better.
I think I was actually going to use exactly the same wedding example. I think we're all clearly reading the same.
We've all had the same
people. Yeah, yeah.
Maybe it's just one person.
Yeah, absolutely. I mean, I think what it says to me though is that the NHS, just in lots of ways, for lots of people, isn't a very good employer, and there's a highly motivated workforce that goes above and beyond. All that stuff is really important for achieving service improvements, productivity improvements. And so I really do think that while there is good reason to say you can't expect public services to achieve the productivity improvements that you might see in bits of the private sector, whether it's high-tech manufacturing outside Cambridge or whatever that's going to be driving the future. But we can and should demand better management, more efficient public services, doing more with less. The answer can't always just be more money, more inputs, higher taxes for everyone. There has to be some discussion and plan around how we can use that better, because I think otherwise, consent for those tax increases isn't infinite. So I think that it's really important that we don't just explain these things away and pretend there's no problem.
I mean, obviously, through the 2010s, public service spending was cut quite significantly in some areas. It looks like that actually was rather bad for productivity in, for example, bits of the justice system, the prison system, where we ended up sacking a lot of experienced prison officers and replacing them with much less experienced ones. But is there a more general lesson, Ben, about the impact of austerity on productivity?
Well, I almost think about it as a tale of two halves, where in the early 2010s, there were some big spending cuts. But until about, say, 2014, most public services actually held up pretty well. There wasn't an immediate deterioration in how well the prison system, the justice system, the NHS were performing. So for those first few years, it looked like we were managing to eke out quite a lot of productivity gains. We were spending less and services were holding up okay. I guess the question really is whether that went too far, and the cuts to things like investment budgets and holding down, staff wages and so on, and getting rid of experienced staff, those things caught up with us. And then in the second half of the 2010s, you see quite a rapid deterioration in the court system, in the prisons. The NHS started missing much more of its targets by a much wider margin. So I think that the lesson is almost, you can eke out some efficiency gains, but if you push that too far, you start eating into, it becomes almost a false economy. You start eating into things that undermine your ability to deliver productivity improvements in the long term. That's quite a high level discussion of quite a contentious, complicated debate, but I think that's one way to think about it.
So one thing that people always say, and I remember this from when I was in government 20 odd years ago, is that there are some hospitals that are much better than other hospitals. There are some schools that are much better than other schools. If we could get the bottom quartile up to the average or up to the top quartile, then product would be massively higher and everything will be fine. And it's a very attractive proposition and seems like a bit of a no-brainer. So why don't we do it?
Several reasons. First is that sometimes those differences can be illusory. They're actually down to some other factor. So if you did a very crude version of that for schools, grammar schools would all be way at the top because they're selective, right? So that doesn't actually tell you that they're better or more productive than schools with much less academically selective intakes. But even if you control for all of those things, you still can't quite grasp the fact that, say, in areas with high levels of immigration, there seems to be higher levels of family aspiration around education. It's almost impossible to capture that in a measure. So there are things that you'll miss when you're comparing that might lead you astray. The other factor is a lot of the real difference between good and less good institutions is down to people, and you can't replicate people. Not easily anyway. You can do a lot of professional development and training. You can try and get the best leaders to come and support weaker leaders for a bit, and that will make some difference. But ultimately, it's very difficult to scale the brilliance of certain individuals that have turned around certain institutions. And so all of these efforts to scale across public sector, they're very sticky. Public sector improvement is very sticky because it's so often down to individuals who are highly motivated or have a particular management ability.
Here's a weird thing. So Wes Streeting gave a speech which actually wasn't that well covered last week or the week before, but it was actually really important, I think, in starting to sketch out his view for NHS reform. So one thing they're talking about is that the best performing bits of the NHS, the best performing trusts and providers, are going to be given, it seems, more capital funding and more control over that capital funding as a reward for good performance, whereas bad performing areas won't be given the same money or the same freedoms. Now, I can sort of see the argument you want to incentivize good performance, but that sounds also a lot like you're going to entrench the good performers, get more investment and stay good, and the bad performers keep getting wrapped across the knuckles by those at the centre. But you don't empower them to change things. It's clearly difficult, but I think if you're trying to narrow variation across the system, that doesn't. May well be a good explanation for it, but it doesn't feel like that's how I'd go about it necessarily.
But it's been, I mean, that in a sense has been the core dilemma in managing public services forever. In a world where you can't let a hospital go bust or close it down if it's poorly performing, you've got a choice. You sort of reward good performers, but then, as you say, you make the system worse. Or actually effectively reward bad performance and kind of maintain the sort of, you don't incentivize good performance, and you potentially entrench the poor performance and poor leadership. And it's again, this is a conversation that's been going on for as long as I can remember in terms of how to do it. And I think the pendulum tends to swing one way or the other.
There's also a question of what incentives you can put in place for the managers and the people who are running these organizations, and the limited role for financial incentives in the public sector, plus the question of remuneration for those people running very complicated big organizations, where if they were doing the equivalent in the private sector, you might well see a zero added onto the end of their salary.
Yeah, and I was just going to add that it's also very difficult the other way around when you're sort of talking about sanctioning poor performance. That there's a good argument for saying if you run a school or a hospital unacceptably, you should personally bear some responsibility for that. And we definitely got some gains from that in the education system in the late 90s, early 2000s, when there hadn't really been any proper accountability, and the government introduced sort of the first wave. But you get to the point where if you introduce too much of that kind of accountability and it's too crude, you start putting people off going for jobs in the most difficult hospitals, the most tricky schools, and you start to treat people unfairly, and then morale dips. So again, it's incredibly difficult to find the right balance in these things.
So I quite often end up sitting next to someone at lunch or dinner or something who's a big shot in the private sector, and they'll say, oh, well, yeah, if you let the private sector loose on this, or if you had these kind of super efficient, high profile chief executives from the private sector go in and run the NHS or run the education system, they'd soon sort it out. That's a slight parody, but only a very slight parody of the kind of conversation that one quite often has with these individuals who have a deal of confidence in the capacity of some people in the private sector to make this big difference. Sam, what do you make of that?
Well, 2 points. Firstly, that our private sector productivity in this country hasn't exactly been brilliant, and quite a lot of evidence that we have a management problem in the private sector here as well. The second is, it's not as if no one's ever tried that, right? Like, governments over the years have got in all sorts of people from the private sector to do reviews and analysis and to run commissions and so on. And they always get a bit bewildered by the fact that the public sector is vastly bigger and more complicated than whatever company that they've been running. And incentives work differently when you don't have profit. And it's much harder in some ways to create the right accountability and incentive structures when you don't have the substandard profit motive. The same applies to charities as well. So whilst I wouldn't rule out the value that some private sector people could bring in terms of specific skills, and I think that's where you can make a difference if you've got a really specific skill in a specific area that can be applied to something like IT. I think the sort of general sense that the private sector is A, much better run, and B, is those skills are transferable to the public sector is very much overdone.
Yeah, I would certainly agree with that, but that doesn't mean that there aren't those with a great deal of confidence that could be done. I suppose the other aspect of this is the way the workforce is managed, is incentivized, is rewarded. I often think back to a conversation I had fairly early in my tenure at IFS with a group of former permanent secretaries. And I can't remember the exact context, but broadly speaking, when talking about sort of delivering a new public service, they were all absolutely unanimous. It was the most important thing was that this was not delivered through a public sector workforce. And these were, not, I think, natural conservative voters. These were people who I think had got very fed up with trying to manage through very complicated, very sclerotic HR processes across the civil service and more broadly. I mean, what is that? Is that a reasonable concern, or is that an inevitable part of a difference between public and private sector HR practices?
I mean, I think that it's very rare we have an interaction with the civil service, or especially like anything HR related, where you come away thinking that it's a well-oiled, perfectly efficient machine. I mean, try to send someone on secondment and the number of hoops to jump through is mind-boggling. Or trying to get data out of a bit of the civil service can be just like a Kafkaesque nightmare. So I think that there's definitely bureaucratic hurdles built in. I think that also the other thing when you talk to civil servants or you read reviews of the civil service is things like bad performers don't get kicked out, they get shuffled around. People just send them to someone else's team to make them someone else's problem. And people at the very top, maybe the pay for senior civil servants has been cut really quite dramatically over the past 10, 15 years, but more than 20%, I think. So are you struggling to keep the top performers? So if it's a people thing, as Sam says, you have to think about which people you have, how you organise them, which ones you try and keep and which ones you don't. So yeah, I have some sympathy with the idea that the civil service could be a little bit more efficient if we wanted it to be.
I mean, I certainly agree with that. I think you find a lot of civil servants are enormously frustrated by these HR practices that mean colleagues who don't work as hard as them and haven't contributed as much don't sort of feel accountability in the way that they perhaps should. I think there is an element that it's public-private, but there's also an element in which it's big-small, right? So you get a lot of people, sort of the classic sort of Dom Cummings argument, if everything was run like a startup. But the reason that startups don't have these problems is because there's 10 people there and they can all talk to each other all the time. The moment you get a big bureaucracy, whether that's a private company with 100,000 employees or the NHS, you lose the ability to operate like that, and things do become more bureaucratic and sclerotic. But that doesn't mean there's no improvement that could be made in the public sector on that front.
Yeah, I certainly agree with that. My experience is very much there's a big small difference as much as there is a public private difference. It's not helpful. I mean, it's extraordinary. The Senior Salaries Review Body report last year suggested that the rate of job turnover in the senior civil service is 25% a year, which is quite extraordinary, and that doesn't help with accountability because no one's there for long enough to take accountability, and clearly doesn't take account. That doesn't help with levels of experience to ensure the best possible delivery. Sam, before you go, I want one or two policy proposals from you. If you're Bridget Phillipson or if you're Wes Streeting and you want a more efficient, more productive education or health sector, what do you do?
That feels like it's another couple of programs there in a few minutes. I mean, I think in both departments, you've got new secretaries of state who are trying to get a grip on very complex systems. And what I want from both of them is an overarching white paper, a sort of vision of not too abstract, but just in the sense of how all these things fit together. How are you using accountability? How are you using incentives? How are you dealing with the incentives that have gone wrong? How are you dealing with management problems? There's issues of scale. There's a lot of similarity between the departments. But at the moment, it feels like there's very bitty policy making, with individual problems being sort of looked at separately. And I think that the sort of single piece of advice I can give without getting into sort of a whole other program on both topics would be you need to think of these things as a system, connect all of these different policy problems together, and try and align your incentives as best you can, albeit that is incredibly difficult to do. And at the moment, I think they're both working towards that, but we're not quite there yet. So we need those plans to understand how they might affect productivity.
So, supposing then we could make a difference here, increase productivity rather faster than has been the case. What's the opportunity? What's the prize? I mean, would this solve all of Rachel Reeves's fiscal problems?
I mean, the annoying IFS answer is no, nothing's going to solve all of Rachel Reeves's fiscal problems. I think it's worth thinking about the short term and the long term slightly differently. I think that often proponents of, if only we could make the public sector more efficient, we could cut spending by some big number. The problem is that rests on the idea that you can translate these improvements into cashable savings quite quickly. And my suspicion is if we found a way to make the NHS much more productive and much more efficient overnight, what that would show up as is waiting times would fall, service quality would improve, staff would be happier, patients would be seeing their GP much quicker, they'd be getting treated much faster, and we'd just see a better NHS. I doubt that what you would see is, oh, great, the NHS is more productive, let's lay off 10% of nurses and keep NHS waiting lists where they are. So I think in the short term, it's very hard to save cash. Over the longer term, you could increase funding more slowly than you otherwise would need to. So yes, it would definitely ease some of the fiscal pressures. But that's a choice. You could either use these productivity gains to provide better public services, noting that lots of public services aren't doing very well, or you can use them to, hold spending down a little bit lower, raise taxes by a bit less, or cut taxes slightly. So it's something we should absolutely aim for and try to improve, hoping for the best. But I think banking on this as your card that you play to get out of this fiscal bind, I'm less convinced by.
Yeah, it's something we need to do. It's good. It helps all of us, but it doesn't necessarily solve that fiscal problem.
As ever.
Well, thanks so much to Ben Zaranko, and especially to our special guest, Sam Freedman, for today's episode of the IFS Zooms In. Public sector productivity is really important, as the famous phrase goes. In the long run, productivity isn't the only thing that matters, but it's almost the only thing, and that's true across the economy, and it's certainly not the only thing, as we've heard from Ben, that matters in terms of the public finances. But getting better productivity is crucial. But as long history has shown, it's also very, very difficult. And to end on Sam's point about needing to understand how the incentives fit together, how the system fits together is the starting point. Otherwise, you fall into the sorts of mistakes that we started the podcast, or pretty much started the podcast with. You change with perfectly good intentions, you change some of the incentives around special educational needs delivery, and you completely accidentally massively increase the cost of delivering a service. And I think that comes from, one can think of all sorts of examples of this through time, and that comes from not really quite understanding the incredibly complex set of interrelationships that come in delivering public services, where in the case of the NHS, you're employing, 1.5 million people or something along those lines. We've got hundreds and hundreds of thousands of school teachers and hundreds of thousands of additional classroom assistants. These are enormous systems, enormous institutions with considerable variation inevitably between how productive individual hospital trusts or schools are. This is something we'll be wrestling with, I'm sure, pretty much for the rest of eternity, certainly for the rest of my life. But wrestle with them we must continue to do. So thank you for listening to this episode of the IFS Zooms In. To see more of our work, do visit www.ifs.org.uk, and to further support us, please consider becoming a member for as little as £10 a month. You can find out more in the episode description. We'll see you next time.